Hello, and welcome to Oncology Central. Today we're joined by Pat and Anne from the Max Foundation. Pat, Anne, could you introduce yourselves for us?
So, my name is Pat Garcia-Gonzalez. I'm the head of the Max Foundation.
And I'm Ann Kim Novakowski. I'm a senior program manager at the Max Foundation.
Could you both give us a brief summary of your career to date?
Sure. So I really, right out of high school, I grew up in Argentina, so I went into nursing with a surgeon in Argentina as a nurse until I was 25 or so. Then came to the United States. I was going to be an advocate for the environment. I came to study environmental education to the US, but then life took me on different roads, and here I am. I've been the head of the Max Foundation for more than 10 years.
So I started university in the field of neuroscience, and I thought that I would go on and get my PhD. My final year in college, I took a course on epidemiology, and when I left university, I thought, wow, this is really, neuroscience has been very fascinating, but that course in epidemiology really stayed with me. So I went and got my master's in public health. After graduate school, I worked with immigrant populations, refugee populations, and found myself at the Max Foundation about 8 years ago.
Pat, you founded the Max Foundation in '97 after a personal experience with a family member with chronic myeloid leukemia. What was your vision for the foundation at its inception?
So I'll tell you a little bit about the start of the Max Foundation. So the Max Foundation was created in the memory of a young boy named Max, who was my stepson, who was diagnosed with CML in 1988. He was 14. And at the time, this was not only before the really great medicines we have now for CML, but it was before the internet. It was a very different to be a parent trying to desperately save a child without the internet. But we managed to seek treatment in the US, and he was treated. We looked for a donor for a bone marrow transplant for him. He needed a donor. We never found a donor. So he passed away in 1991 when he was 17. But also, when you spend 3 years trying to save a loved one, you learn so much, you become an expert. And so we thought that we had a lot that we had learned and that we could share with other people so that, they wouldn't have to go through what we went through alone. And so the vision for the Max Foundation, we had this idea that we would be a bridge between resources that exist out there and patients that otherwise would not know about them. And the other thing we really wanted was to make sure that we don't duplicate resources. So anything anybody else is doing, we're not interested in doing. So we really focus on neglected populations.
Could you give us an overview of the foundation's mission?
Sure. So the mission of the Max Foundation is to provide global access to treatment, care, and support for people living with cancer. We have what we call a continuum of care. So we have 3 pillars to our work. The first one is access to treatment. The second one is education and support, and ultimately strengthening communities by training advocates that can provide services to the patients in their own communities.
And since joining the foundation in 2009, you spearheaded various patient access programs, such as the Max Access Solution Program and the Patient Access Tracking System. Could you tell us a bit more about these initiatives?
Certainly. So the Max Access Solution was the Max Foundation's response to the needs of the community. And when I talk about community, I talk about our community of patients, our community of physicians, even our partners. People want to be able to save lives. Our physicians want to be able to save lives. And Max Access Solution is based on years of the work that we had done with our partners in drug access. It's all of our best practices, it's all of our experience rolled into a program that enables companies who want to do good work to donate medicine to the vulnerable populations. The PATS system, Patient Access Tracking System, is essentially our customer relationship management tool. It enables us to track each individual patient throughout the treatment life cycle, from the moment that they are diagnosed until the time they come off treatment.
Thank you very much. And how do these initiatives weave into the Foundation's approach to access to treatment?
So ultimately our vision is a world where patients live with dignity and hope. And this access solution ensures that patients who need access have access. So a physician will diagnose a patient in a particular country and knows that a therapy exists for this particular patient. That physician reaches out to the Max Foundation to inquire, is this something that you can help with? And based on the relationships that we have and the partnerships that we have, we're able to help bridge access so that a company who previously didn't know how to get drug into the hands of that particular patient, we facilitate that for them.
Pat, could you describe some of the global hemato-oncology programs that the Foundation has been involved with as part of the Max Global Network and some of the organizations you've partnered with?
Sure. So, I think that we cannot speak about the Max Foundation without speaking about our partnership with Novartis. And then in 2001, Novartis, a pharmaceutical company, was coming out with a treatment for CML, the same disease Max had, that really changed the nature of this disease from a terminal disease that Max had to a disease that you can live for many years just taking a pill every day. So Gleevec, which is this drug, really revolutionized, I think, the treatment of cancer. It was the first targeted therapy. And so we ended up entering into a partnership with Novartis. They were willing to make sure that people would not go without because they couldn't afford it. But they, because it is a type of cancer, it's a type of cancer that's a result of a mutation. So you need to make sure that patients are really diagnosed properly with this disease. So our role in this partnership has always been to make sure that we verify that every patient really has CML or any other of the indications that are treated with Gleevec, and then liaise between the physician and the company to provide access to treatment. So this has been called the GPAP program, the Gleevec International Patient Assistance Program. We have managed this program for the past 15 years. More than 60,000 people around the world have been helped.
Dignity and hope in the face of cancer is the Foundation's vision. How important is it that the health sector remembers this when developing accessible treatment plans for patients?
I think as we have grown as an organization, it is very important to us that we don't lose our connection with the patient. And because of Max, I think for us, still after 20 years, every patient is Max, every family member is us. So we remember that, I think there's nothing worse, or maybe the only worst thing that being diagnosed with cancer is to be told that there is a treatment, but that because of the place where you are, you cannot have it. So I think by providing access to treatment, we give hope. We cannot always win the battle against cancer. It's a very terrible disease, but we give hope, and we make sure that people don't have to lose their dignity in having access to treatment. So those are really key visions of the Max Foundation.
And I would also add that it's very important over the years. What we've learned is that our partners in this process, we do our best work when our partners are aligned with us in that vision of a world where patients have access, where they live with dignity and hope.
Alongside collaborating with private organizations and patient associations, the organization has funded various educational programs for patients. Could you give us some examples of these programs and the vital roles they play in patient support? We've
realized, and we work with neglected populations around the world in places where very low resources. So, it is great that we can have access to treatment, but sometimes, let's say, patients don't have the money they need to take the bus to go to the clinic to take the treatment. So really, we do a lot of education and support of patients. We put on workshops. We do coaching where let's say we call patients every month to make sure they're taking their treatment, or make sure they're coming back. In the places where we work, there's a great stigma of cancer. So these workshops and patient meetings that we organize become this sort of safe haven where people have a place where they can actually talk about their disease. So we put a lot of energy into providing this support and education for patients. We have worked for the past 12 years with patient survivors in many countries to form local patient organizations. So we have helped form about 40 different local patient organizations that can, so the peer-to-peer support, I think, is very important.
And it is a tiered approach. Patients need to have access to treatment in order to survive their disease. And once they've had that access to treatment, then they're looking for what's next. They want to be able to give back, and by connecting with others in their community who have a similar diagnosis, who are living with cancer, living well with cancer, it enables them to not only support each other, but also find other ways to advocate on their own behalf.
And finally, where do you see support for cancer patients in about 10 years' time?
So we are scaling up our work. We have realized that we have learned a lot during the past 2 decades, and that we are setting up all the systems to make sure that if there is a patient that has been diagnosed in some country and there is no access locally, that there is a channel through the Max Foundation to provide safe access to that patient. I have to tell you, we talk about access to treatment, and it is not only about providing access to the medicines. The logistical piece of actually bringing drug into these countries and have it when the patient comes to the clinic, it is not easy. And people talk a lot about, low and middle income countries. You have to do a lot of strengthening the healthcare system, and I understand that. There is a lot of work to do, in providing diagnostics. We do a lot of work providing diagnostics. Yet, we all agree that we all need to help in these areas of training and support and strengthening the healthcare system. Yet today, there are patients who need the drug today. And so this is what we hope to be the vehicle in oncology for providing access to treatment to patients that otherwise would go without.
I think that really we would love to see every cancer patient who requires access to treatment have access to treatment regardless of where you live. And in particular, those truly vulnerable populations where they would not otherwise have access. To have treatment in their hands within 10 years' time would be a wonderful accomplishment.
Thank you very much for taking the time to speak to us today. Do you have any final thoughts for our viewers at all?
I want to say we've talked a lot about the Max Foundation. We don't do this alone. There is nothing that the Max Foundation does by ourselves. So it is our partners, it is the physicians that give their time tirelessly, it is the companies that provide support and access to their treatment, it is the patients that come and really are partners with us. So, it's all about working together, and I think that this is the best way that we can help each other, is by always working together. So I think at the Max Foundation, one of the core pillars of our work is collaboration. So.
And I think there is this broader mission and the work that we do with partners that's very important. We couldn't do the work that we do without them. But I think speaking individually and personally about the work that I'm doing, I think many of us have been touched by cancer, and I think cancer can be a very devastating disease. We throw so many things at cancer: radiation, chemotherapy, transplant, immunotherapy, and they do in some cases more harm than good. And in the work that we're doing, we are able to convert and spin that sort of model on its head. When we do these things, when we throw all of these different treatments at cancer, we're trying to give people more time. And so what I like to say is that time is the currency of cancer. And by giving people hope and by allowing them to live their life with dignity, we're able to convert that element of time. We're able to convert it into hope.